for this lovely introduction given to me.
Thank you.
And yes, it's an immense pleasure for me to share some information with these budding children. I know most of them have an idea of what I'm going to speak, but hopefully I will be able to motivate them of what they know actually. But I don't know how many of them are practicing it. So yes, today's my talk is mainly dealing with the young children and about their oral health. So here, without wasting any more time, I'm going to start my presentation. Okay. Okay. Hello, children. I hope all of you are doing fine. You had a good vacation and the new year was, I'm sure, fantastic. So today I'm going to lighten on the topic, know more about your oral health. Why I'm saying know more is because I know that most of you have an idea of what oral health means, and you all are practicing the daily routine to maintain a good oral health. But here I'm going to give little more information and also motivate you on what you have been doing every day. So I guess I'm dealing with the age group of class 6th to 12th. So somewhere you are of age 11 to 17, right? So what do you call yourself as? This is the age group which we call you all as adolescents. Sorry. Yes, this is the age group which we call as adolescence. What is adolescence? This is the age group which is a transitional growth, transitional exaggerated growth and change in social role seen in new children between the childhood and adulthood. So this is the phase where you come out of your childhood and you're going to enter the adulthood, right? So, but most of you are already feeling that you have already entered in adulthood, but this is the most tricky age for me as specialist periodontists because it's very difficult for us to make you understand what is good because most of you already know what we are doing and we are perfect in what we are doing. So anyway, this is the age group where you're between the childhood and adulthood. And many organizations have classified your age group as 10 to 19. Also, there is an organization which classifies your age group between 10 to 21. So roughly, this is the age group 10 to 20 is what I'm dealing with. Now, what are the aspects that we need to see in new children? New children have distinctive needs. That is, you have high potentiality of dental caries, even though because of the new technologies of power brushes and new toothpaste in the market and many things, yes, you all have the potential to get high dental caries because of obvious reasons that you have tendency to poor oral hygiene, your nutritional habits are not that good, especially in the holidays and now with the lockdown. There's no particular routine maintained. And also, there is a poor routine oral health care access. How many of you do you regularly come to a dentist for a check? Most of you come to us only when you have a pain, right? So your routine oral healthcare access is very less, which in turn leads to the increased risk of periodontal disease. Now, what is a periodontal disease? I will explain to you in my further slides as I would go. There are high chances for traumatic injuries because of the sports that you are all into. Dental phobia, very common. Even at this age group, you are scared to come to dentist. The reasons given are the drills and the instruments, which look very scary to all of you. There is potential use, and nowadays the media and the internet gives a lot of information on the tobacco, alcohol, and other recreational drugs. So this is the age where you're more enthusiastic or more curious to know what are these products about, but they're a complete no. Desire for oral piercing, which is more common in the girls. Eating disorders, more common in the girls. Increased risk of pregnancy. Now, this is something which used to happen in the rural areas because of the lack of education, but now also there are some places where they have a tendency of increased risk of pregnancy. Unique social and psychological needs, and most important, an increased aesthetic desire and awareness. Now, these are the following points why we as healthcare professionals need to approach you children. But at the same time, there, there are times that you children also approach to us. And the main reason for it is the aesthetic. When you all approach to us, you all approach with the emphasis on what matters to you the most. You all want to be in the fitting in category where you want to be be fitting into the peer group or the other society, so that you're always available or wanted in the popularity, which increases your self-esteem. The dating scenes have become high now, so all this comes down to aesthetic concern. So what I'm saying is the children at this age, when they voluntarily come to us, main reason is the aesthetic concern. They don't know what is more important than that, but what is for them the concern is aesthetics. Now I would begin my presentation with the basics. Let me start with the basic. That is, you should know what you mean by teeth and periodontium, right? Now, if you can see this is my model with an upper jaw and the lower jaw. So these are the teeth, right? Now, at this age group, you have 24 to 28 teeth, which does not include your last third molars. Now, every tooth has two parts. The part which is above the gums, which is called crown, and the part which is inside. The part which is inside the gums, which is called the roots. Now, what do you mean by periodontium? Periodontium are the tissues which surround your tooth, which includes your bone, gums, periodontal ligament. So this is the whole unit which makes your oral cavity. Okay. The crown, which is on top of your gums, is covered by the white coat. That is called the crown enamel. That is called the enamel, which you see the white part in your teeth. Beneath it is dentine. Okay, and inside that is pulp, which is the nutrition giver. It is the living tissue which consists of blood vessels and nerves. Now this has to be protected from the dental caries progress. Okay, the tooth inside, the root inside the bone is covered by cementum, and this is cementum, and this root is attached to the bone by periodontal ligament, that is periodontium. Okay, now you all can do a small experiment. Just clench your teeth tightly and release. Clench again and release. When you do this, you feel when you're clenching, the teeth go inside, right? And when you leave, they come out. This is because the teeth are cushioned by the periodontal ligament. They are not directly fused to the bone. Okay, so these are the components of your teeth. The basic explanation is what I have given before I progress. Now, why is oral health important? Oral health is important because we are giving you the oral health education, motivation to maintain a good oral health. We're talking about the risk assessment. When I say risk assessment, that is, we need to classify every individual on how much high risk they are to develop these oral diseases. Not everybody is the same. You might always say that my younger brother eats more than me, but he does not have any decay. Why do I have? Every child, every individual has its own risk, okay, of developing the oral diseases. Also, because we need to tell about the preventive measures. Prevention is always better than cure. Now, your oral mouth, the mouth is just not consisting of teeth, gums, and tongue. It is the entry to your body, right? So whatever you eat, you swallow, goes inside. Along with this goes your microorganisms, which are inside your mouth. Now, if your mouth is not kept clean, there are a lot of microorganisms which go inside your body. Through the bloodstream, they can go affect many internal organs like heart, liver, which you all are not aware of. You all are at high risk of developing heart diseases or diabetes. Yes, it's not just by any cholesterol or sugar and all, but this your dental conditions can also affect. So you should know your oral health so that you know how to prevent the development of these diseases from the basics, that is tooth pain because of dental caries, gingivitis, halitosis, which is very annoying. Imagine having a friend in your group who has a bad breath. It's difficult to have a communication with them even for 5 minutes, right? So halitosis or tooth loss because of dental caries. So these are the various reasons why we are here to speak to you. You need to know your oral health. You need to know why they are so important. Okay. I will deal with them step by step. The first and the most important thing I'm going to talk is dental caries and periodontitis. Let me talk about dental caries first. What do you mean by dental caries? Dental caries is a complex microbial infectious disease. Now, every term, every word has its own meaning. Complex because it does not involve only one microorganism. There are many microorganisms which are normally present in your mouth. Okay. It's a complex microbial infectious. When I say infectious, is because even if you have one tooth decay in your mouth, it can spread. If it is untreated, it can spread to 2 or 3 or 4 or 5, multiply the teeth decays. Okay. Also, it can spread from one person to the other person from basic things of sharing food. Yeah, it happens in every houses. You're sharing food, you're sharing the spoons, you have something tasty you want to feed. But if you have decay, yes, with the simple process of sharing spoons, also the decay can spread, right? That is one of the reasons we always try to educate the pregnant ladies to have a screening for oral health so that the decays are controlled at that stage. Okay. Now, it's a complex microbial infectious disease. How does it happen? How does it spread? Uh, See, the decays, it's faster if you eat something sweet, right? But it is not only because of sweet, it can be because of any food if it is stuck in your tooth and it is not cleared. That's the reason we say that you need to brush your teeth after every meal. At least 2 times you need to brush. So after you finish your dinner, you need to brush before you go to bed. If you do not brush and if there is food stuck in your teeth, you sleep for 8 hours. That 8 hours is enough to start the process of dental decay. Okay? So how the process starts is, the food is, in a basic, if I explain, the food is stuck to your tooth. The microorganisms attack these food debris and they release certain acids. These acids can cause demineralization. When I say demineralization, it means it loses the mineral content of the tooth, and slowly over the time, the hole can be formed in the tooth. It does not happen in one night or 2 nights. It takes time. So, but if the practice of yours continues for months or years, this can progress. In certain ages, it's the progress that is the younger age. It is the progress is much faster. Hmm? So the moment the decay is formed, it will continue to progress if it is not controlled. This, you can see the picture here. I'm going to say the dental caries has different stages: enamel caries, dentine caries, pulpitis, and periodontitis. Right? Enamel caries can be the preventive caries. Okay. The next slide. Can you see this? Can you make out this white lesions that you see on these tooth along the gum margin? These white spot, they are called white spot lesions. Okay. These are the reversible lesions. These are the initial lesions. This is how the decay starts. But they're very difficult to visualize with your naked eyes. So it has to be, usually it is seen by the dentist. And that's when we try to tell you and educate and motivate you. See, there is decay happening. You better be careful and start the preventive measures for this so that it stops at here. If you do not continue with any preventive measure and it continues, it then goes to your dental caries, dentine caries, that is this picture with the black spots. At this point, you have to go and get the teeth cleaned and filled. If you neglect at this point, usually you develop sensitivity on having something cold, hot, or sweet. But you neglect at this point, then it further goes to pulpitis. That is, the previous slide I showed you the layers of your teeth. Now the dental decay has entered the pulp. So when it is into the pulp, It causes pain. At this point, you develop a lot of pain. Dental pain, trust me, can be very bad. You cannot sleep, you cannot eat. But if you neglect even at this point, you take medicines and you get rid of pain, it can progress to periodontitis. Can you see the picture down? See, the teeth are so bad. Here, these teeth are not cannot be saved because the decay, the infection has gone progressed deep into the tissues. Not just the pulp, it has gone deep into the tissues along the root. Okay, so this is the last stage. At this stage, usually the teeth are removed, they cannot be saved. So the decay, which can just be prevented by the early monitoring, if neglected, can come to the stage where you end up losing a tooth. So what I'm trying to say is, please be careful of having a continuous vision of what is happening to your teeth. If there are any changes in your teeth, if you see there is some sensitivity happening or tooth color changing, anything tooth broken or something, please do visit the dentist at the early. Take it as an emergency and do visit. Do not delay it. Now, my first point when I told that dental caries are at high risk on your children, that is because of certain reasons. These are the reasons. The reason is this is the age where you get mini teeth, especially the age group between 10 to 13, 10 to 14. This is the age group where your milk teeth are falling, the new permanent teeth are coming. By 13 or 14, you have developed all set of permanent teeth except your third molars. Okay, so you have 28 teeth by 13 to 14 years. Now, 10 to 14 years, there are changes happening. In that changes, the milk teeth fall, the permanent teeth come. When the permanent teeth come, if they come in an environment which is not clean, you have not brushed properly, you have not flossed or done proper cleaning, eaten junk food, imagine the environment it comes in. It does not come in a clean environment. So the teeth which come new have the immature enamel. The enamel, that is the outermost layer, is not very strong yet, and it already gets exposed to a negative environment, right? So, and also there are more teeth coming in your mouth now, right? There are, what do you call, and the teeth are changing. The number of teeth from 20 is increasing to 24 to 28. There are more teeth coming in your mouth. So that is the second point. Third point, as I told, not proper nutritional habits, having junk food too much. Fourth point is not maintaining good oral hygiene, because now you take the responsibility of brushing your teeth yourself. This is the age by now all of you are doing on your own. I guess I'm right. All of you are doing on your own. You have taken the responsibility that I'm going to maintain my own oral hygiene. That means you're giving it as a less priority. As your madam has already told before, there are many chores in the morning that you need to perform. Of one is brushing, which is given the least priority. You need to rush to the bus stop because the bus is coming. You need to get ready fast. You need other activities. Brushing is the least, which finishes in 30 seconds or 40 seconds, right? So this is not done. These are the reasons why you develop dental caries. Now, I've been speaking about periodontitis. I should tell what is periodontitis. Periodontitis is the deep inflammation of the gums. The gums which covers your root, right? It covers your root. Now, if there is a superficial inflammation, it is called gingivitis. The gingivitis, if it is not controlled, it goes down to periodontitis. If I show you the picture, this is gingivitis, okay? Can you see this? This inflammation. This red margin along the tooth, this is gingivitis. Right, kids? I hope I'm audible to everybody, right? So this is gingivitis. Okay, this is the superficial inflammation of the gums. If this is not controlled, if you can appreciate, there's white spot lesion already here along the gums. Okay, these are the white spot lesions which are along the gum. Usually the white spot, that is the reversible lesions, will happen always along the gum margins. That is where the gums start and the tooth ends, the crown ends. This is where you will see the white spot lesions. This is where the decay starts for not proper brushing. Hmm? So this is superficial gingivitis. If not treated well, it goes to periodontitis. Now, at your age group, adolescence, you have high risk of developing gingivitis because of hormonal changes. These hormonal changes have an influence in your oral microorganisms, microflora, that is the microorganisms in your mouth. What type should be there? That changes because of your hormonal changes, okay? And these can have an effect on developing gingivitis. So you are anyway at a high risk of developing gingivitis, but because of your poor oral hygiene, it becomes exaggerated. It is increased. So you have to take good care of your teeth. Again, there are numerous conditions that I told you, development of diabetes or heart conditions can be developed at this early age because of the negligence done by your children. So the best is to prevent them, that is by performing a good personal oral hygiene and also going for a periodic intervention by the dentist. Okay? What are the recommendations with all the talk which I did? The recommendations are basic, that please go regularly for a thorough oral examination by your dentist. Also, that we do simple encouragement of simple measures, that is brushing your teeth. You need to brush 2 times daily. Please remember, you have to brush 2 times daily, and it has to be for at least 2 minutes. You need to brush each time at least for 2 minutes and need to floss once, preferably in the night, because that's when you have more time also, right? A little effort of prevention put by you people, by you children, can have a lot of effect by preventing any serious diseases that can happen. Okay, having a tooth loss is also a serious condition at such a young age because of just a negligence. Okay, now what I've been using the word prevention. What do you mean by prevention? I will tell in my next slide. Prevention. Now, what I'm telling about treatment, when I'm saying treatment, I'm talking about the various measures that can be done, which includes your preventive measures. Okay, there is primary prevention, secondary prevention, tertiary prevention. Today, I will speak about primary and secondary. Now, primary prevention, this is the procedures which are done to prevent development of any health condition. Okay. Now, these are the steps you need to perform regular basis so that you prevent development of any oral diseases. Okay, one of them is fluoride. Fluoride, the higher classes know it's an element, and I don't want to get into the atomic number or molecular weight. The basic I want to tell you is something which is naturally available, but it has been proven scientifically that it can cause caries prevention. It has an effect on controlling the dental caries, provided it is taken in a certain limited quantity, which is again classified by the American Dental Association. You don't have to worry about that. All your toothpaste that you get has a certain amount of ppm of fluoride, which is designed. Okay, but you have to brush with it. So don't go for any toothpaste of something which you are not aware of. Go for something which has fluoride. You need to have a fluoride content in your toothpaste. Okay. Now, the fluoride can be obtained from different sources. One is by yourself, that is by using a fluoridated toothpaste. Just a small pea size. You don't need to fill the whole toothbrush. Just a small pea size is sufficient to brush your 28 teeth. Okay, so the brushing twice daily with a fluoridated toothpaste gives a good topical fluoride effect on your teeth. This is done by you. At the same time, we also can introduce fluoride as a preventive measure by putting fluoride varnish. If, for example, you come to us for a regular checkup, I observe bad mild gingivitis around your teeth. At the same time, I observe the white spot lesions. My regular professional, the scaling or the cleaning of the teeth, followed by application of fluoride varnish on your teeth, will enhance. It will be an enhanced preventive measure given by us. Again, followed by you people by brushing 2 times daily with a fluoridated toothpaste. This is an example I'm giving. Okay, so you need till the age of 16 to 17, the topical effect of fluoride is beneficial. Okay, oral hygiene, very important factor. You need to brush properly, keep your teeth properly so that you reduce the risk of development of dental caries and periodontal diseases. Okay, at the same time, reduce on the exposure of cariogenic substances like chips and chocolates and candies. Candies are more dangerous than anything, trust me, because they stay in your mouth for a long time and they really reduce the salivary flow, which cleans your mouth. At the same time, increases the frequency of acid attack on your teeth. Hmm? Now, we are here to motivate you. You need to motivation so that because you have already become independent, you have taken the charge of brushing your teeth, which is given the less or least priority. Right? So you need to spend time. I know the more important works, important activities engaging you, brushing is the least important. So we need to motivate you by telling you what are the benefits. If you brush your teeth with a fluoridated toothpaste, you are introducing the beneficial effect of fluoride, topical effect of fluoride on the tooth. At the same time, you're removing the plaque, brightening your teeth, and reducing the halitosis. As I told you, halitosis can be very annoying. So, and the one of the main reason for halitosis is bad oral hygiene, dental caries, and other systemic conditions also can lead to halitosis. So, yes, my all the talk always says, please brush your teeth twice daily for at least 2 minutes each time and floss once daily. Okay. The recommendations are adolescents should be educated and motivated to maintain a good oral hygiene. At the same time, you should visit the dentist for the professional or a dental hygienist for a professional removal of plaque and calculus. These are the two terms, plaque and calculus. What you mean by them? Plaque is a gelatinous film which is formed on the tooth, which is a natural process. It forms on your teeth. When you get up in the morning, this is a film formed over your teeth. You brush to remove this film. It is consisting of microorganisms and it is a sticky material. Okay, so just by washing your mouth or gargling, it does not go. There are certain disclosing solutions, which are available in the market. We used to tell the small children to use it, a tablet, to chew and spit. So all the teeth which has plaque, where all you can see it, and you just brush to remove all the plaque completely. But you children are big enough to use that. But what I'm saying is, this is a gelatinous material which is covering all your tooth surface and more towards your gum line. Okay. So you need to brush so that you remove this plaque. That is the reason we say brush twice, because again the plaque is formed after certain hours. If you are not able to remove plaque, which happens even after good brushing over a period of 6 months, 7 months, the plaque, over the time, the plaque cannot be removed. So over a period of 6 months or 7 months, the plaque starts getting calcified. Okay, that is, the calcium deposition starts on them and they start becoming calcified, forming a brick-like or tooth-like material on the tooth. That is called calculus. This calculus cannot be removed by your brushing. You have to visit for a professional cleaning. Now, this is a video but before the video, I can also show you what is brushing. See, can you all see my video? Now you have to always hold your brush at an angle, 45. Never hold it vertical, like never hold this horizontal like this. Never brush your teeth like this. No, you have to hold at an angle. Can you all see this? This is an angle of 45 degrees. Okay, you're supposed to hold at an angle and make short vibratory strokes and go down. Make short vibratory strokes, circles, go down. Every time you brush, you cover 2 to 3 teeth at a time and you clean it. So this is how you cover all your brushing outer surfaces. Open your mouth, then you need to brush your biting surfaces. With your front teeth, for your front teeth, you need to do these movements. So imagine you have 28 teeth. 28 teeth will at least take 2 to 3 minutes, right? 30 seconds are not enough for them. Let me show you the video, and I hope this video is clear and you can understand my brushing technique.
Brushing at least twice a day.
Now I will show you the next video for the flossing. Yeah, please see the video and then I will speak about it. This is from the flossing of teeth.
Floss your teeth. Your teeth.
Okay. Now, the previous two videos was to give a brief on how you're supposed to brush and flossing. So I I guess you have understood how you're supposed to brush. Never brush like this. You are slicing off your tooth if you brush horizontally like this. You have to hold the brush at an angle of 45 degrees to the tooth. Okay, and give gentle strokes, because with this, you are cleaning the gum area. Also, you're cleaning the between the teeth areas also. Flossing, yes, you need to do flossing. If any problem with, if you have not understood or you have any problem in when you're doing it, you can visit a dentist who can show it to you physically there. Okay, but otherwise it's no difficult. You need to take arm length floss, rotate it around your fingers, and floss at one, start with one area and proceed to the next tooth. When you finish each area, you fold the used floss and unwind the fresh floss so that you have used the whole floss. Okay, so we have spoken about fluoride as a preventive measure. We have spoken about oral hygiene. The third preventive measure is diet management. You need to have a good, proper diet management. You have to reduce and control the quantity of refined carbohydrates. When I say refined carbohydrates, I mean biscuits, pastries, cookies, donuts. These are very harmful and not good for our health on regular basis. They are junk food. They are to be used very rarely. Now, this is the age you are supposed to eat. I cannot say don't stop, but whenever you eat, you need to brush your teeth. This is one thing. You have to brush your teeth whenever you eat this, but definitely it has to be reduced, not readily, not to be consumed as a daily food. Acidic beverages like colas, Pepsis are definite no-no. Sport drinks. In fact, I would always suggest, if children with sports, then they go, it's better best to take water. When you have these sport drinks, which have high sugar content, when you are actually in the sports activity, you're sweating, the saliva in your mouth reduces. And if you take the sweet drink, it is going to increase your dental caries activity. Okay. And junk food, introduction to coffee, all has to be reduced. Coffees can stain your teeth, right? So you have to be sure that you brush after every meal. That is, if you are into junk food, brushing 2 times is a compulsory thing. Okay, but just brushing with the plain water without any paste after eating any junk food is also good. And floss daily. Your busy schedules, and now with the present lockdown, always available at home, the mama is always cooking yummy food for you all, your holidays are in, there are too many junk foods and too many snacking habits, right? So you have to choose now. I won't say don't snack, but you have to choose what kind of snack you eat, what is good for your teeth. Always try to choose your snack, a fruit salad or boiled peanuts with some chaat masalas or Indian spices, having boiled corn with some spices, cheese cubes. These are good. These are definitely good. Snacking on these items are definitely better. Popcorns, these are good items. Okay, but popcorn kernels can get stuck to your teeth, so you need to brush if it is stuck. But these are definitely better than having one packet of chocolate cookies or having a bar of chocolate. They are more damaging. So choose on the snacking item what you want to eat. I'll tell you a secret. If you have decided that you have taken a thing that today I am going to finish this bar of chocolate, you have decided, it's in your mind, you have to finish it. Fine, go ahead, finish it, but finish it in one time. Don't try to break that bar of chocolate into 10 pieces and eat it over 10 hours. That is more damaging. Eat it in one shot, go, brush your teeth, finish. When you try to eat over 8 hours, 10 hours, the whole day, you are damaging your teeth. Okay? Because that many hours, the chocolate is stuck on your teeth. That many times, many parents come to me, they tell she's too much into sweets, she's too much into chocolates, doesn't eat vegetables. You tell what to do. So we all, one of the things we always do is diet analysis. We always tell the parents, make a diet chart and give us, which includes the holiday, because always a munching and snacking is more in a holiday. There's no definite routine. That's why I'm saying now from past 1 year, definitely your oral health would have gone for a haywire, because there's no definite routine. You're not going to school. There's no definite lunch break, morning break, coming home and having your lunch, sleeping early. There's no routine. You're getting up late, you're all the time snacking. So the things go change. The routine is changed. So we always ask for a diet charts that we do a diet analysis of what is to be omitted, what should be introduced, and how you can change. We don't say don't eat sweets. No, stop. No, it's difficult to understand this age. But only thing what we can say is include it in your food. Do not make it as a snack. You want to have one laddu? Have it. Have it with the lunch. Have it with your food so that you eat, you brush. Don't have it as a snack. That can be more damaging. I hope you understand this. All the food looks yummy. Yes, even I'm very fond of donuts. I'm very fond of cookies, but no, they are not good. Having boiled egg is nice, or cheese cubes. Cheese sandwich is good, but then again, the bread is a carbohydrates rich food which can stick to your teeth, and you need to brush. So, whatever you eat, please choose. On the longer term, these are more beneficial for your health. Sealants. This is the fourth point. Sealants. Now, this is applied only professionally. You cannot apply it. This, what is it? It's a plastic fluid flowing material, okay, which is applied on your back teeth, molars. Now, this picture, can you see which is written pits and fissures? There's my cursor. Yeah, the pits and fissures, right? All your molars have these pits and fissures, which are normal, right? But some patients and some children, they are very deep. They are very deep and retentive. So even the brushes cannot clean into the depth of your pits, into the depth, because bristles also go only to certain depth. These are very fine depth. Bristles cannot go. So many times, if these are developmentally very deep, they retain the food, and even if you brush, some amount of food even then remains and gets into decay. So what do we do is we put something as sealants so that we seal these areas, we seal them so that they become smooth and they're easy to be cleaned by you, right? So we reduce the chances of development of decay by these placement of sealants, which is done in milk teeth or permanent teeth. We check which needs, we perform on that. Okay. So these are the four primary preventive measures which I told, that is fluoride, good oral hygiene, diet counseling, and sealants. These things, if you manage properly, you very less chances for you to develop dental caries. Now, the second would be the secondary prevention. When I say secondary prevention, these are the preventive measures done to detect early diseases, early dental caries, so that you can stop them there and give them a proper treatment. That is by secondary prevention is happening when there is something in your mouth, you be detect in the early condition, and we treat them properly so that it does not spread further. And this can be done only if you visit periodically every 6 months to 1 year to your dentist, and he checks if there is any early lesion, any white spot lesions. He puts the preventive measure of fluoride, he performs the scaling, he does sealants if it's needed, so that any new decay happening can be prevented. Okay? Mainly adolescents have to be monitored because they don't like to come. Periodic oral examinations is the key in this secondary prevention. Sometimes the preventive measures does not proceed. Okay, as I told you, demineralization. When a caries attack happens, demineralization happens. The acid removes the mineral from your tooth and causes demineralization, leading to a hole formation. The hole is not formed immediately, right? First, the white spot lesion is formed, where we try to perform preventive measure of applying fluoride. Sometimes that does not become successful. The demineralization continues. If it continues and there is a formation of hole, we need to restore. Okay. Again, it is taken care and assessed by the dentist of what kind of filling you need and what is good for your teeth. But this is again the secondary prevention because you're stopping it here. You're stopping at the filling stage, which is good enough. Okay. So my topic on dental caries and periodontitis, I would end this topic by just making a gist of saying that maintaining a good nutrition, healthy eating habits, maintaining a good oral health care by brushing 2 times daily for at least 2 minutes each time, and you flossing once daily, visiting your dentist regularly can reduce the percentage of development of dental caries of periodontitis to many folds. Okay. The second topic which I would deal with you is malocclusion. The name itself says it's malocclusion. Okay. So it is different from your normal occlusion. Many times children themselves come to us that we are not happy with the arrangement of our teeth. So you are aware of it. By this age, you know what the teeth, how they should be arranged and how it should not be arranged. But still some children, some are not aware. Okay. So we need to tell them that the malocclusion can happen at any level. It can happen at one jaw, only one jaw, because of change in the tooth size or jaw size. It can happen between both the jaws, relation between both the jaws, or it can happen between the relation of your skull to the jaws, right? It can be at any stage. So this can affect your quality of life. If you are not having a good set of teeth properly arranged, you do not have a healthy smile, you cannot brush your teeth properly, you are finding it difficult to eat. These are the basic problems that you can face. Now, simple thing is your upper teeth, upper front teeth always should be front when you bite. They should be forward. The lower one should be behind. But if the reverse is happening, that is, your lower teeth are in front, this is an alarming situation. You have to come for immediate consultation, immediate checkup. Okay? So these are the conditions which will not give a will disturb the biting pattern and the normal growth, okay, of your bones. Many of you all, as I know, are aware of what is not a proper arrangement of tooth, and you have already visited your dentist and you're going ahead with your orthodontic treatment. Now, if you're going ahead with your orthodontic treatment, you have to be motivated to brush properly. They are even more difficult to brush when you have these braces and arch wires in your mouth. It takes more task for you to brush, but you have to be motivated because you have to maintain. These can harbor very bad oral hygiene, plaque, and if you do not do properly, the areas around the brackets can be the places where you can develop dental caries. And how do we motivate you? We motivate you by showing certain pictures of some children who do not maintain good oral hygiene and how bad the teeth can become if you do not maintain good oral hygiene. Okay, so please follow your dentist who is undergoing orthodontic treatment. Visit them regularly. Show them the teeth. If you need any further oral hygiene procedures, perform them and listen to how to maintain your oral hygiene. There is a slide. Yes, this is the video which I will tell you for the children who are using braces. Now here, the angle of 45 degrees is opposite. Which is without the braces, you're normal, it is in a reverse direction. Here, it's in the opposite direction. You cannot do like that because you have brackets down. Understand? Sorry. This is how it should be. This is the angulation of 45 degrees for children with brackets. The reverse is when you're doing without the brackets. Now, this is how you're supposed to brush your teeth and keep it clean when you have braces. Okay. I'm sure the orthodontist would have explained to you all, but this is just a slide including giving you again further motivation. Third molars. Third molars, this is the teeth called wisdom teeth. They come around the age group of 17 to 21. Okay. Because I broadly classified adolescents of age between 10 to 21. I'm using this, bringing this topic. Also to widen and brighten your information. Third molars, wisdom teeth are not necessary that everybody will get. Okay, some gets, some they're supposed to be four, one on each side. Some will get two, some will get three, some will get only one, some will not get any teeth, or some will get all four teeth. Hmm? Now, what happens is they are supposed to erupt between the age of 17 to 21 years. Okay. Now, when they are coming, there will be a lot of pain in your, because by that age, the growth has stopped. The bone, jaw bones are not going to grow further. Whatever the space is available, the teeth will come in that space. If the space is enough, the teeth comes nicely. If they are not enough, they come in a tilted way. Hmm? And there'll be a lot of pain. When I say acute and chronic problems, what I'm telling is the acute are the immediate problems. Chronic are which do not create problem and they're long for they stay for long time. The main problems that you can see that can annoy you is when the teeth are coming, they can be very painful. They can cause inflammation of the tissues around your erupting teeth. That is called pericoronitis. Okay, that is the inflammation of the tissues around the erupting teeth. You cannot brush there. You find it very difficult to brush. It's paining too much. Further makes it difficult to clean it and further increases the inflammation. That is one. Secondly, is can have development of dental caries because they are not, if they're not in a proper position, they're not properly placed. If they're outside placed, your brush does not go there, they can develop dental caries. Fourth could be the development of periodontitis. Okay, that is the inflammation of deep gums. Sometimes, now one more thing is, for example, you have reached the age of 30, 35, and you have seen that your third molars have not come. So you can go for a periodic checkup where a radiograph, the whole OPG, full mouth X-ray is done. In the X-ray, if there is teeth there and it is dormant lying inside the bone in a very wrong position, you have to get it removed because that tooth, firstly, has a risk of developing a cyst. Secondly, it can damage the tooth which have already come in your mouth and you need them. Okay, tooth number seven, the front teeth, you need them. But this tooth is not going to come anyway, but it is because of its position, it is damaging the teeth in front. So what we suggest is after 2021, if you do not have your permanent third molars, get one full checkup done so that you know whether you have it or not. If you have it, it's come fine. If you don't have it, it's fine. But if they are there and deep inside the bone lying in a wrong place, you have to get them removed. So it is the dentist who will evaluate and check whether your third molars are going to be functional tooth or they have to be removed. Okay. Dental trauma. I think many mothers have this problem. The children. I've recently had a patient, mother came with two boys, and both of them had the broken upper front teeth because both of them were boxing at home. So what I'm saying is you don't need to be in any sport to have a dental trauma. You can, it can happen anywhere, a fall or just boxing with your sibling, and more commonly seen with boys. Definitely more commonly seen with boys. Again, these dental traumas can be prevented. Okay, they can be prevented, but at the same time, you need to know what are these effects that can happen when you have the dental trauma. The most common teeth affected because of dental trauma are your upper front, especially if the teeth, if the children have these protruding forward teeth, definitely. Otherwise, also the first impact will come on the upper front teeth. Boys are most commonly affected because of the sports activities, because of the physical activities they do at home, any impact on the surface. You don't have to be into boxing field. Any leisure sports of like skating, skating rolls, or trampoline, or bicycling, all these leisure sports can also cause you trauma. So, and the area most commonly affected is your face and the teeth. So you can prevent them by introducing protective equipments. Okay. The previous slide has shown these are the various protective equipments. Okay. These are face guards and mouth guards. See, the boxing one, he's wearing a mouth guard. This is the face guard. The cricket people, they wear face helmet. But these face guards and mouth guards, when you're bicycling, when you're into these sports, it's better to wear so that you prevent. Again, these have to be custom made, properly fitted. If it's not fitted properly, it can lead to further complication. Okay. If you have faced a trauma, it can have a long-term sequelae. It can have a long-term effect. That is, firstly, the pain. Secondly, the aesthetics. Third, the tooth loss. Okay, if it is not properly treated, you can end up losing the tooth. I can give my personal experience. I was cycling or I was skipping. I don't remember. I was in the sixth grade. I fell off and I broke my front tooth, upper front tooth. But yes, there was no education that time, or no, not education. That's a wrong word. It's no awareness. There was no awareness that time of how to manage if you have such an incident. We neglected it. Though I had the broken piece of tooth with me, it was lying there. Luckily, it happened at home clear, so I didn't have to get any tetanus. One more thing I need to say is if any trauma happens outside in a soiled environment, you have to get a tetanus injection immediately within 24 hours. Yeah. So, but with me, it was at home, but we were not aware, so we just left it. Over the time, over months, I developed tooth pain. I then had to go for root canal treatment, then I have to go for crown. So I have a crown, but trust me, this could have avoided if I knew that I can fix the tooth with the piece which I had. But please, I'm making it very clear, this is to be done only by the dentist. Don't try to experiment at home, taking a Fevikwik and fixing it your teeth. No, that's not done. This is done only by a dentist, but not in every situation. Not every situation is possible, but some situations, yes. You need, why I'm saying these things is please don't take trauma light. This is an emergency situation. You need to come emergent as an emergency care. If any kind of trauma has been faced to you, there could be traumas where you have lost the tooth completely, comes out, or the tooth has gone inside. This has to be taken care immediately. You cannot come after 3 4 days saying he had a swelling, so we wanted the swelling to come down. Now we have come. Now I can't do anything. You have to come immediately. If the tooth, for example, has come out completely, please get it immediately to a dentist as early as you can. Best is within 20 minutes. And don't get it dry in your hanky or a cloth or something in your hand. You have to put it in some liquid. Could be milk, coconut water, if nothing, island solution, or if nothing is available, plain water. But you have to get it. So the best is the timely management. It is very, very crucial. When you have any kind of trauma, you have to come to us immediately. There are many awareness programs where they tell them, where we educate them that please manage. The best is prevention. Go for the preventive measure of using proper mouth guards and face guards. But even after then, if you face any kind of trauma, if any unseen things happen, you need to visit immediately to take immediate care. Okay, the mouth guards should be fitted properly and they have to be custom made. Otherwise, a wrong fitted one can in turn itself cause a damage to your teeth. Okay, tobacco, alcohol, recreational. Now, these there are media's giving a lot of information, net giving a lot of information. There is keenness to know at this age by the children what it tastes like, what it feels like. Everybody says you feel high, you feel nice, you feel light. So everybody's curious to know, right? Especially this age group wants to know what it feels like. Why only the elders have to test and tell me not good? I also need to taste and tell it's not good. But I would say please don't go for it. It is a complete no. It's an argumentative talk where you all children will say we also want to taste, we also want to know, but it is a complete no. These things are complete no. For simple effects they have an effect on your teeth, on your mouth, in the body as a thing. Now tobaccos are used in various ways, like it can be cigarettes, cigars, BDs, hookah. and e-cigarettes and smokeless tobacco, many things. I don't know, there are too many things in the market. I'm also not aware of them. Children know more than me, but they're not good. What I'm saying is, please do not, especially the age group of adolescents, we need to motivate them. We need to say, keep yourself away from them. You have high chances of development of oral cancers with tobacco, high chances of development of pancreatic cancers or lung cancer or cardiac conditions in case of tobacco, alcohol, or nicotine. Even if it is not these oral cancers, okay, they are extreme situations, but simple thing of staining your teeth, halitosis, they can be very annoying. Imagine if you have stain on your teeth because of smoking, and smell is very annoying to people around you, right? Passive smoking is equally bad, and it can have a negative impact on your sports, on your education, which is of prime concern. At this age, you should be enjoying your life, having a good food, play, do a lot of physical activities, study well, and excel in your life than getting into these activities. Hello? Sorry? Can I continue? Okay. Now, the recommendations here is they can have oral and systemic consequences on your oral health. So when we try to educate the children, do not use it. But even then, if there are some children who use it, we send them for the counseling services, educational services. But at the same time, if we detect any kind of lesions, then we do a treatment. You won't believe, but the dentists are the first one to see any kind of lesions which are precancerous, that is before the development of cancer. We can detect them and we need to treat them. Okay, so the my recommendation is completely no, no, no for these kind of drugs. Oral piercing. This is again something very common, and there was a period which was very much uh, popular in India, where you try to put a gem on your tooth and you look beautiful. But please, again, no, these are the areas which are not recommended for piercing. You are not supposed to pierce these things in your mouth. They can be harmful. So, and they don't look good. You see, these are the gum piercing, tongue. The lower area is so sensitive. There are so many nerves and vessels running around. How does the person know where he is piercing and what he's going to do? He can damage your nerve, which can have a permanent effect in your future. Oral piercing, which is inside your mouth, or perioral, that is around your mouth, are completely no, because of any local or systemic disadvantages or adverse effects it can have. The basic adverse effects you can have is pain, swelling, hematoma, that is collection of blood, abscess, delayed healing, nerve damage, bloodborne infections like hepatitis B, C, HIV, choking of any loose jewelry, delayed healing. Enamel, when you put the jewels on your tooth, it can cause enamel fracture, which can cause long-term sensitivity, leading to further pulpitis or other problems, and speech impairment. So there are many, many drawbacks of doing this. So why do this? Why take a chance? You see the picture where he has inflammation around? This can be very painful, and getting this removed can be even more painful. So please, this thing is a complete discouragement. More seen in girls, so please no. Psychosocial. Now this is the mainly seen for the girls. Can you see the picture? Every girl feels that she looks like this, but she's actually like this. Uh, what I would try to say here is you need to eat healthy. Okay, I'm not trying to say that to eat and become obese. No, obesity is not good anyway. But you need to eat what is required for your body, what is required for your age, so that you have a healthy leading life. Right? Don't try to starve yourself just to get uh, into the note of being the thinnest girl in the class or thinnest girl in the society, in the in your school. No, that's not the fashion. What is important is that you eat healthy nutritious food and keep yourself healthy. The psychosocial this is what the girls, this is the psychosocial consideration what we are telling. Okay, there are two types of eating disorders that you see, that is anorexia nervosa and bulimia. Apart from the psychosocial, there are other considerations like your behavioral considerations where the children have a lot of anxiety, phobia with the dentist. Could be because of their previous exposure, okay, or could be because of what they have heard from heard from their friends, or they have seen the siblings do. This get recorded in their mind. So could be because of any reason, but these children and children with intellectual dysfunctions, could be cerebral palsy or Down syndrome, these children have to be dealt separately, where we specialists give them ample time. We deal with them in a different way. So they are in a complete different priority. But psychosocial considerations, as I said, anorexia and bulimia, these are two conditions of which bulimia is called a purging behavior, because bulimia is the condition where the children eat food and they vomit. Okay, they vomit. So when they vomit, they throw up a lot of acid. And when that acid goes out, it causes erosion. Erosion is dissolving of the teeth. The acid in your mouth coming in, acid in your stomach, which comes in your mouth, can be very, very damaging. It can erode your teeth. Now, these erosions can increase the chances for dental decay. This kind of behavior is seen in bulimia, not in anorexia. Anorexia, the children starve themselves. They reduce on the quantity of eating, they reduce on the frequency of eating, which can again result in other side effects of your body and also cause gastritis, which again causes uh, the acid reflux, but not as much as your bulimia. But what is the treatment? When we see such children, we tell them firstly to stop the behavior. And secondly, every time if you have this vomiting, we tell them to rinse their mouth with high fluoride containing mouthwash or brush your teeth with toothpaste and make a frequent visit so that we check your teeth and see if any treatment is needed. When we approach this age group about oral health, there are certain things we speak. We speak that oral health is apart from your normal physical body, your normal other care, oral health is equally important. You need to take good care. You need to perform good oral hygiene measures by brushing 2 times daily. You need to take care of your nutrition. You need to take care of your physical activity. These are the aspects we approach the adolescents when we talk about oral health. Now, it's been a long talk, I guess. I hope I have managed to keep some kids awake and some information into your head, but I would quickly summarize it. The whole topic comes down to basic things, that please brush your teeth 2 times daily for at least 2 minutes each time and floss once a day. When I'm talking about brush, they can be manual brush or power brush. I personally recommend all my children manual brush because you need to first master the technique. Power brush, there's no, you just have to hold the brush and it goes in its own motion. But you need to know your technique before you use a power brush. But again, if there are certain children who have been advised to use a power brush by their dentist, please proceed with that. No doubt, power brush is more effective, but you can manage good with your manual brush. Third, please manage your diet. You need to have a good dietary analysis, good diet management, so that you other prevent any oral uh, problems and your health problems. Preventive measure like fluoride. You need to go for a fluoride varnish every 6 months or at least 1 year, once a year. Okay. Use of sealants, which are advised, checked by the dentist, and proper use of mouth guards for children who are into sports. So these are the preventive measures that you have to, basic preventive measures, and every 6 months or once a year meeting a dentist so that we intervene at an early level and treat them at an early level. Apart from that, where I say a complete no is for your oral piercing, a complete no for the use of tobacco or any other things which can be harmful for your health. The next slide, the next video is the last where I would finally educate in a small way. Okay, children, with this, I would say thank you so much for being patient and listening to my talk. And I hope I've been able to motivate you and educate you on certain aspects. And I hope you all have a good future and take care of yourself.